Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so get this. Imagine knowing years in advance if you're at a higher risk for certain cancers.
Yeah.
Not just like based on your family history, but on your actual genes.
Hmm.
It's like a sci-fi movie, right?
Yeah, it really is.
And that's the kind of possibility that's explored in this new study out of the Journal of the American Medical Association Network, Open.
Right.
We're going to deep dive into that today.
Yeah, this is a big one.
What's so cool about this is that it shifts the focus
Oh, absolutely.
from like reacting to cancer
Exactly.
to like proactively identifying those at risk.
Yeah, most genetic testing happens after a diagnosis
Right.
when preventative measures are less effective.
Too late.
This research wants to change that.
Yeah, and that's why I'm so excited about this.
Right.
It's all about catching it early.
Exactly.
The article we have here says up to 10% of cancers
Oh, wow.
are caused by genes we can actually test for.
That's a huge number.
That's a lot of people.
A lot of people that could benefit.
Yeah, who could benefit from this kind of screening.
This study involved 12 primary care clinics,
12 clinics.
over 95,000 patients.
Wow.
So it gives you a sense of the scale.
That's not just some small lab experiment.
Yeah.
This is the real deal.
Real world implications.
So, how did they actually approach this? What methods were they testing?
They tested two approaches,
Okay.
both designed to be really smooth in primary care settings.
Okay.
So the first one was called point of care,
Okay.
and it involved patients completing a family history questionnaire
Okay.
right before seeing their doctor.
Okay.
The second one was called direct patient engagement.
Okay.
They invited patients to fill out the same questionnaire online at home through letters and emails.
So one's capturing people right there in the moment.
Right.
The other one lets them do it at their own pace.
Exactly.
Makes sense. So what exactly were they looking for in these questionnaires?
So they were assessing a family history of cancer,
Okay.
focusing on first-degree relatives.
Parents, siblings, that sort of thing?
Exactly. Parents, siblings.
Okay.
Then second-degree relatives like grandparents, aunts, and uncles.
Okay.
And they also looked at ethnicity
Makes sense.
because certain ancestries have a higher risk for specific cancers.
Right, right.
And only patients whose responses showed a potential for elevated risk
Okay.
were offered genetic testing.
Makes sense. So they're trying to create a very detailed picture
A detailed picture of individual risk.
of your individual risk. And something that really struck me
Yeah.
was that the genetic test was provided free of charge.
Yeah, free of charge.
So they're really emphasizing that this should be accessible
Absolutely.
to everyone.
Not expensive specialized health care.
Yeah.
Just integrating this into routine care for those who need it.
Yeah. And what did they find? Does one approach prove to be more effective?
That's where things get interesting.
Okay. I like where this is going.
While the point of care approach,
Right.
that in-clinic questionnaire,
Mm-hmm.
had a higher completion rate at 19.1%. The direct patient engagement approach.
So focus at home.
Exactly.
Yeah.
Had a significantly higher rate of actually completing the genetic test when offered 44.7%
Wow. That's a big difference.
compared to 24.7% in the point of care group.
Wow. Those numbers are really interesting.
Yeah.
It seems like offering the test in the clinic resulted in more people filling out the questionnaire.
Right. More people initially.
But those who were invited to participate from home were far more likely to follow through with the genetic test itself.
Yeah, I think it brings up some interesting questions about patient motivation and self-selection.
Right. Like, are the people at home already concerned about their family history?
Potential.
Because they're already motivated?
Yeah, they're actively seeking the information.
So it's not just about catching people in the doctor's office.
Right.
It's about reaching those who are already thinking about this.
Yes, those who are motivated to take action.
And that's further supported by the fact that the direct patient engagement group also had a higher percentage of people testing positive for a gene linked to cancer risk.
Right.
That's crazy.
Yeah,
So even though the point of care approach had a wider initial reach,
right.
the direct patient engagement method seemed to be more effective at identifying those at higher risk.
Yeah, and who are actually motivated to get tested.
So it's not a simple answer of like which one's better.
It's not a simple answer.
They both have their pluses and minuses.
Absolutely.
What did the researchers suggest as a way forward?
Interestingly, they proposed combining both approaches,
Okay.
beginning with broad outreach via direct patient engagement,
Okay.
and then supplementing that with targeted point-of-care screening.
Gotcha. So cast a wide net, and then if you're at the doctor, they might say, hey, have you thought about this?
Exactly.
That makes a lot of sense.
Two-pronged approach.
Yeah.
Capitalize on the benefits of both methods.
That's what makes the study so significant. It's giving us insight into how we can create more effective screening programs.
More effective screening programs for cancer risk genes.
This brings up an interesting question. If offered this type of genetic testing in your doctor's office, would you take it?
That's a good question. I don't know, would you?
It's a lot to think about.
A lot to think about.
There's a lot to consider.
Absolutely, and we'll dive deeper into that in just a moment.
Okay, sounds good.
Yeah. So it's important to remember, like, a positive result from this kind of genetic testing
Right.
doesn't mean you're definitely going to get cancer.
Right.
It just means you have a higher chance
Okay.
compared to someone without that specific genetic variant.
So it's all about probabilities, right?
Exactly.
It's not a guarantee of the future.
No, not a guarantee.
Okay.
And that's why it's so important
Right.
to have access to genetic counseling.
I was going to say, like, what happens if I find out I'm at risk?
Right.
What do I do with that information?
Well, a trained counselor can help you figure it out.
Okay.
Talk about your results.
Yeah.
Potential preventative measures.
Okay.
Screening options.
Gotcha.
Lifestyle changes.
Okay.
All tailored to you.
So it's like not just about the test itself.
Right.
It's about giving people support
Yeah, support system.
so they can figure out what to do
Exactly.
with this information,
Empowering individuals
Yeah.
to navigate all of this.
this new world.
Yeah, this landscape of genetic information.
Which is great because that's what this study is all about.
Exactly.
It's not just about the tool.
Right.
It's about making this part of healthcare.
Part of the healthcare system,
Yeah.
making it practical and patient-centered.
Like we were saying earlier, it's about access
Access for everyone.
to this information.
Exactly.
But there are some limitations to this study, right?
Oh, of course, every study has limitations.
Right.
For example, this research was done during the pandemic,
Oh, yeah, that makes sense.
which was tough on healthcare systems.
Yeah, I can imagine.
Like, for instance, variations in how the point-of-care approach was implemented. I think some clinics did the questionnaire in person.
All right.
Others did it over the phone because of telehealth.
Right, because of all the changes.
Yeah, so it's hard to compare results.
Gotcha. So the pandemic had an effect.
Absolutely.
Okay. Any other limitations?
Yeah, another big one was relying on patients having email and knowing how to use online platforms.
Right. Not everyone has the internet,
Not everyone, and some people aren't tech savvy.
so that could exclude people.
Absolutely, it could.
Okay.
Also, we don't have all the data
What do you mean?
on the people who said no to the risk assessment.
Oh, so we don't know why they opted out.
Exactly. We don't know why.
Interesting.
And it's important to remember,
Yeah.
this was just one study.
Right.
More research is needed.
Yeah, science is always evolving.
Absolutely.
No.
But even with these limitations,
Yeah.
this study offers important insights into making genetic testing for cancer risk more accessible and effective.
It feels like this research is pushing us to consider like some big questions about ourselves.
Yeah, like what?
Like if we can know our genetic predispositions,
Yeah.
should we know?
It's a tough question.
Is it always good to know the future?
I mean, on the one hand,
Yeah.
knowing your genetic risk could help you be proactive.
Right, like make lifestyle changes.
And exactly, lifestyle change.
Maybe get screened more often.
More screenings.
Yeah.
You could even consider preventative surgery,
Oh, wow.
all potentially reducing your risk,
Right. But that knowledge could also be scary,
right?
right? Like if I know I'm at a higher risk for cancer,
Yeah.
even if I never get it,
It could weigh on you.
Yeah.
That's the thing about genetic
it's a
information.
double-edged sword.
Yeah, knowledge is powerful,
Yeah.
but it can also be a burden.
Right?
It's a personal decision.
Yeah.
Weigh the benefits and risks.
And decide what's right for you.
exactly what feels right for you.
There's no right answer for everyone.
No right answer for everyone.
And it makes you think about the unknown. Do we really want to know everything about the future?
That's a big question.
Or is there something good about mystery?
Deep philosophical questions.
Yeah.
I think it's up to each person.
So this research is making us confront
Yeah.
some really fundamental questions.
About who we are and how we live.
As genetic testing becomes more common,
Yes.
we need to be having these conversations
Open and nuanced dialogue.
as a society.
Yes, as a society.
So what's next in all of this?
I think we need to keep making these screening methods better,
Okay.
more accessible,
Yeah.
more effective.
Okay.
We need to reach everyone. especially those who don't usually have access to healthcare.
Right.
And more research is needed
Of course.
to understand the long-term impact
Of all of this.
of genetic testing
Okay.
on individuals and on society.
So it's a huge challenge.
It is a huge challenge.
But it seems like an important one.
A worthy challenge.
Well, we've covered a lot.
We have.
This fascinating world of genetic testing for cancer risk.
We've explored the science,
Yeah.
the potential benefits,
The challenge.
ethical questions.
And all the implications.
Absolutely.
Hopefully this has given you a lot to think about.
I hope so.
Maybe even talk about.
Yeah, talk about it with your family and friends.
Yeah. So it's amazing to think we're like on the verge of changing how we deal with cancer.
Yeah, it's a huge shift.
But with all this new genetic testing stuff,
Uh-huh.
what about the ethics of it all?
Oh, that's a big one.
It's a complex area.
Yeah, as genetic testing gets more common,
Right.
it raises all these questions about privacy,
Right.
informed consent, discrimination,
Like, could someone deny me insurance
potentially.
based on my genes?
It's a real concern.
It's kind of scary.
These are tough questions.
Oh,
We
yeah.
need to think carefully about this.
It's like we're opening this Pandora's box of
Yeah.
information.
We better be ready.
Yeah. Are people going to freak out
That's possible,
if they find out they're at risk?
even if it helps them take action.
Right? They might get overwhelmed.
Yeah, it's crucial to have counseling and support.
Right. So people can process this stuff
Exactly, and make informed choices.
that work for them.
Right, that align with their values.
So it's a balance
It's a balance.
between giving people knowledge
Uh-huh.
and protecting them.
From distress.
Yeah.
But isn't that what good decisions are about?
Right. You weigh the good and the bad,
Exactly.
and then you decide.
Just right for you.
Yeah. So we need to talk about all this,
Openly, honestly.
about genetic testing.
Yes.
Not just the science,
Right.
but the human side of it.
The human side of it.
Genes are just one part of the story.
One part of a bigger picture.
Right. It's up to each person to decide
Yeah.
how they use that information.
For their health journey.
Could genetic testing one day be like routine? Like checking your blood pressure?
It's possible. If
Okay.
tech gets better and cheaper,
Right.
genetic testing could become standard.
Imagine that.
Imagine finding out who's at risk early on. Yeah.
And tailoring their care.
So it's personalized.
Yeah. Personalized medicine.
That's a future I'm excited about.
Me too.
We're not just waiting for disease to happen.
Right.
We're managing our health
Proactively.
based on our genes.
Exactly.
Wow.
This research is a step towards that future.
It's pretty incredible.
It's exciting.
Well, I think it's time to wrap up
Yeah.
this deep dive.
Into genetic testing.
We've covered a lot of ground.
A lot of ground.
Science benefits, challenges,
Ethics.
personal implications.
Hopefully you have a better understanding of this whole thing.
I hope so.
Maybe you'll even learn more about your own genes.
Yeah, see what it means for you.
Knowledge is power, right?
Absolutely.
The more we know, the better decisions we can make.
For our health.
Thanks for joining us.
Thanks for having me.
And until next time, stay curious, stay informed, and stay well.
Thanks for tuning in to the Health Headliner podcast by Todo Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.